Hello, my dear friends. Today we will speak about the abdominal portion, examination of abdomen as well. So let's begin with anatomy mainly. And then we will going through some specific examination and some YouTube videos which will help you to understand the way how you have to do that or this manner as well. Okay, so first of all, this presentation will be uploaded for you with some matchable dancing on the portal as well. So I need very common ideas about it. So yes, some of the portion is slightly difficult to you, but why not? You're so perfect and great person that can afford it. So let's see what is given to us. Exam of the abdomen. See, here is given slides perfectly after the cardiovascular system, which I already for you in previous week. So, the major component of the abdominal exam include inspection. Inspection, it means that what can you see without contact with your patient, with your eyes only, okay? Auscultation. What is auscultation? Who can remind me? Auscultation is portion when you use some specific tool like stethoscope to understand the different sounds that comes from the inner organ and describe and make some decision by the sound you hear in the person. Percussion. Percussion. So maybe you know this word from the music as well. So all kind of band has percussion system where they took some temp some tick or kind of. So what is percussion? When you use your finger and make some sound hitting the tissue and take the sound back. So this is percussion. And palpation. Palpation comes from the word finger, from the Latin and Greek, my dear. So pressing by the finger and understanding what's happening inside your organ, inside the cavities is palpation. So from which part consists our abdominal examination, my dear? Observation or inspection, auscultation, percussion, and palpation. Slightly later, I will give you understanding why auscultation comes as second point after observation, not in the last, because in the cardiac system or otherwise, percussion, palpation, and only after will be auscultation. So in abdominal vice versa, the first of all you do auscultation and then other kind of examination. While these are the same elements which make up the pulmonary and cardiac system. They are performed here in a slightly different order, as I say. So auscultation before percussion comes here and carry different degrees of importance. Pelvic, genital, and the rectal exam, all parts of the abdominal evaluation, are discussed elsewhere. Okay, let's see. Um, The first of all is inspection or observation, yeah. So you are looking on the patient. So till you are looking on the patient, let's see where abdomen is and what is the main point, the more main border of abdomen. Abdomen is below the thoracic cavity, as you remember, my dear. So all our anterior or our body is divided into portion. Thorax, which consists of the rib cage mainly. So and abdomen, which on the back side has some vertebral column like a main stable portion, and soft tissues around it. Yes, so from the anterior side, it's mainly the soft tissue like skin, muscle, and some inner organ, which are soft as well. So, and where is the borders, my dear? So, includes it's below the thoracic portion. So, rib cage makes some specific upper border. See here, my dear, this is ribs, the last ribs, which makes the upper border of the abdominal cavity. So what we have in the middle of abdomen, on the upper side, the upper part of it, see on these pictures, you can see something triangular coming down from the mid side. So mid-bone, you remember its name, sternum. You remember it, sternum or chest bone as well, like it's said in the socium in the population, so in people. So the most low portion of sternum is xiphoid processus. Xiphoid processus is additional part of the sternum, which in the very young age is connected with the sternum with cartilages and then fused with it. So, and it is border part, sign part for abdominal cavity from upper side. So, on the right and the left, we have some oblique line coming from the rib cartilages. This part is cartilages, my dear, and low portion is bony part as well. So in the middle of the abdominal upper side is the void processes. Then come very soft portion, and downside the how it is. The border of the abdominal from a low side is some pelvic and hip bones. So part of hip bones, you can feel it if you check your body as well. Make some oblique, as you see here, part which fused in the middle side in the pubic, like pubic portion, pubic symphysis. So this is the low border. So upper part of the cage, low border is hip bones fused in the pubic symphysis. So from the side, we have no border, then the skin. It's only the skin on the side. So everything that we have on the lateral sides is the abdominal side till we can see it, till skin and this portion as well. So how we divide? So everything that is inside we cannot see. We cannot see HEPA, we cannot see stomach, we cannot see intestine, we cannot see kidney, we cannot see spleen. All these portions are covered with soft tissues like specific fat, muscle, skin. So, but they are inside it. So, and we have to understand what's happening with this inner organ by looking on the abdomen and examine this abdomen side as well. So we have to remember where which portion perfectly exists, and we have two ways to do this observation. We can divide on 9 quadrats. Look on the first picture, my dear. 1, 2, 3, 4, 5, 6, 7, 8, 9. As you see, the lateral upper and low quadrats are very small triangular kind of as well here, my dear. See, other is covered with a bony structure, but as well it exists. So other are soft. But as well, we can divide abdominal part on 4 quadrates, which is more simple to us. For today, I will describe both ideas, but we will follow the 4 quadrats examination as well. So, if it is 9 quadrats, what we have to do? We have to find the low portion of 9/10 rib, take the line transverse kind of. So now we have Another line as well transverse on the most anterior, not lateral, my dear, anterior, on the anterior surface as well here. This is the most anterior side, which is the most low portion bony structure here. Other comes on the lateral side, as you see here. So on anterior side, we take the most superior portion and divide our abdomen on three parallel sides. So what we have? Upper, middle, and low portion. So now it's three section, yes? What we have to do now? We have to take vertical lines from upper side down. So where it must be, it can be taken like two parts. Look here. Do you see this clavicle bone? Or take the midline of this clavicle, um, or take this midline of clavicle and take the vertical lines, or on the anterior side you will find the vertical muscles, and by these vertical muscles on the lateral side of vertical muscle, rectus muscles, you will take this border kind of line and divide on now 9 quadratus. So in each quadratus is some specific organs inside which must be described. Okay, it's difficult to remember all of them. You have only to remember how we divide it on 9 ones. So what about another part? Another kind of division is on the 4 quadrats. 1, 2, 3, 4, as you see, and it's easier because in umbicus is the middle part. This part, my dear, everyone has in the middle is umbicus. So on this umbicus I do vertical line and horizontal line. So it's divided on 4 parts. What I can find upper right, upper left, low right, low left, quadratus. So the main idea is it on the right side I can find hepa or liver. On the left side mainly we have spleen. Some part of the stomach is middle to the left as well. Some part of the hepa can be found on the left side as well, as you see on the picture. Intestine is from the middle side going down and makes some curvatures, so it's difficult to understand where which one is, but for sure the big intestine, the wide, the short one but very wide one is coming from the right quadrant, low, going up, upgoing portion, transverse portion, slightly above umbicus, then makes angle. Here on the both sides it makes angle, going down, descending part, and to make some sigma on the left part, and then goes to the anus or to the anal canal. Where all the rest is going, like fecalis are going out. Okay, so let's see the main landmark. So xiphoid process in the middle, coastal margin or coastal rib oblique lines, midline on the umbilicus, as I say. What we have? Inguinal ligament perfectly where the hip bones are going down slightly above it. On it we have found the inguinal ligament. So and superior margin of the pubic bone. This is the main points we have to remember in the abdominal through the examination. Let's see what is here. When looking, listening, feeling, and percussion imaging, as what organs live in the area that you are examining. The abdomen is roughly divided into 4 quadrats. Right upper, right low, left upper, left low. By thinking in anatomic term, you will remind yourself of what resides in a particular quadrant and therefore what might be identifiable during both normal and pathological states. Okay, once again, this is a real person now, and do you remember what we do? We find umbilicus slightly, its line is not perfectly on the umbilicus, but okay, let's take it like mistake done on the picture. So from xiphoid process till the pubic symphysis, we do vertical line. On the umbilicus, we do horizontal line. It must be here, my dear. See, this is umbilicus as I remember. So, and we have right upper, right lower, left upper, left low quadrants. You remember what we find in the right upper quadrants? Mainly HEPA. HEPA is going slightly to the left side. On the left side, we can find as well stomach and spleen. So, my dear, if you find something on the left upper quadrant, you will understand that problem can be only in these organs, not in the maybe small intestine or HEPA portion or kidney as well. Yeah, so kidney is in the midline, slightly more low portion. It's a right and left side, deeper than other organs. So let's see. Okay, so at the umbilicus line, slightly above the umbilicus, it's transverse portion of the big intestine and colon. Yes, so let's see. See, here you can find the same what I say, but drawn on the patient. So liver is covered by the rib cage, excuse me, slightly going down from the rib cage as well. Stomach is middle going to the left. It's in the both side can be found. Spleen is only on the left side, covered by the rib cage as well. But you can, if it is enlarged, change the shape, and some problem exists, you can find it below the rib cage. So this is our ascending descending colon seen and transverse as well. The very important portion will be, and we will discuss it, auscultation of aorta as well here, and bifurcation of aorta and some iliac portion, and some arteries that goes to the kidney as well, my dear, must be discussed and find out all the normality and abnormality of this portion. Okay, let's see what is given to you in your presentation to understand what we have to add to this discussion. So much information through the observation, inspection, in other words, my dear, can be gathered from simply watching the patient and looking at the abdomen. This requires completely exposure of the region in the question, which is accomplished as follows. Ask the patient to lie on a level examination table that is at a comfortable height for both of you. At this point, the patient should be dressed in a gown and, if they wish, underwear. Understand, yes, he is very step-by-step described what you have to do and how you have to. Not only what you want to find, but how to examine. So patient must feel comfortable. When you check your patient, it must be comfortable for both of you. That's why gown is given here. So it's very easy to take up and find the skin and other portion. But sometimes we need underwear because patient must feel some protection from the patient, from the physician as well. So once again, where you have to take your patient must lie, so not vertical, not sitting position. In sitting position, because inner organs are soft, full of liquid, some food and so on, they will by gravity power taken down, so they will change the position, normal anatomical position, and you can do some mistakes through the examination, as well as sound like tympani, which comes from the ear field cavities inside the abdomen, will be changed by the shape and the position in the inside the abdomen, because of ear always go upside. Okay, so take a spear bed sheet and drape it over their lower body, such that it just covers the upper edge of the underwear, or so that it crosses the top of the pubic region if they are completely undressed. This will allow you to fully expose the abdomen while at the same time permitting the patient to remain somewhat covered. The gown can then be withdrawn so that the area extending from just below the breast to the pelvic brim is entirely uncovered, remembering that the superior margin of the abdomen extends beneath the rib cage. Look here, my dear, this is prepared patient. So he's lying on specific bed on the high, comfortable to physician as well as to the patient, because if it will be very low for physician, it will be difficult to palpate and auscultate. If it will be very high as well, some problem will exist to the patient to lie on this kind of bed, or to physician to reach to catch the upper portion of the abdomen. Then the gown, here you can see the patient is in the gown. It's easy to take up or down. You have to cover with a sheet, of course, new and clear sheet, the low portion. So you have to uncover only the portion which you examine to make patient comfortable. Take the pubic symphysis from the xiphoid processes as well. Understand? Okay. Let's go down. The patient hands should remain at their side with their heads resting on a pillow. If the head is fixed, the abdominal musculature becomes tenses and examination made more difficult. Allowing the patient to bend their knees so that the soles of their feet rest on the table will also relax the abdomen. So, if patient is slightly tense, ask him to rise his leg, not leg but knees, and feet taken on the bed perfectly. So, firmly. So it will make some angle, but abdominal muscle will be relaxed, my dear. So it will help you to examine your patient. Keep the room as warm as possible and make sure that the lighting is adequate. Why lighting is so perfect, my dear? Light must not be vertical as it is in the surgery area, because you do not need to cut something, you need to observe something. So it must come slightly oblique. Why? Because shadows that it makes on the abdominal will give you some explanation, my dear. When it is very vertical, you have no shadows, so some different changing in the tone of the color must be disappeared, and we will do some mistake in the understanding, as well as some veins, and you see here some rose portion, some dark purple lines. Yes, it's veins as well. From the strict light can disappear or take some more light color, so you can find them perfectly. So light as well. So this is particularly important early in your careers when your skills are relatively unrefined. However, it will also stand you in good stead when examining obese, anxious, distressed, or otherwise challenging patients. While observing the patient, pay particular attention to appearance of abdomen. So the first look on your patient will give you some understanding of some kind of disease. Maybe from first look you can do some first diagnosis as well. So, is it flat, distended, and large? Does this appear symmetric, or are the distinct protrusion perhaps linked to the underlying organomegaly? What is organomegaly? Inside our abdomen we have some organs. So megaly is increasing in size. So if you have hepatomegaly, it means that your hepa, your how it is? Liver is bigger than a normal person, yes, dramatically bigger. Or splenomegaly, it means that spleen is bigger than normal. The contour of the abdomen can be best appreciated by standing at the foot of the table and looking up towards the patient's head. Global abdominal enlargement is usually caused by air, fluid, or fat. So in this our patient for sure it's fat and airs, I think so, because if it was ascites from cirrhosis or other kind of, here will be more visual vein picture will be given for us. Okay, we will see it. I will show you how it looks like when we have some ascites coming from the cirrhosis system. Okay. It is frequently impossible to distinguish between these entities on the basis of observation alone. See below for helpful manners. Areas which become more pronounced when the patient valsalvas are often associated with ventral hernias. I will show you how valsalvas maneuver is done. It's very interesting, my dear. These are point of weakening in the abdominal wall, frequently due to previous surgeries, through which omentum its inner organs covering, my dear, intestines, peritoneal fluid can pass when intra-abdominal pressure increases. So look once again on this patient. Okay, this one. So muscle and skin make some sheet, some covering, but if in the sheet some way, some less how it is contact between the tissue, so we can find out that inner organ can come through this sheet outside. So what will happen then? Some bulging on the skin can be seen. If you increase inner pressure in inner side of abdomen, of course it will bulge out more dramatically. If outside pressure is more than inside, so it will stay inside the abdominal side. I will show my dear. Don't think about it. Yes, okay. So, okay. Presence of surgical scars, my dear. Surgical scars, it's very interesting. Sometimes patient, when he discuss with you his medical history, forget about the scars. It's normal if patient is in age or has some memory problems as well. So he perfectly can forget that in the age of 2 years has some kind of surgery done on the abdominal side. So in this period you can find lanalexia, chest maximum. Okay. Okay. So excuse me, my dear, some problem exists, but okay. So scars, yeah. So he forget about the some surgeries that can be done in the age of 1 to 2 years for sure. Not every of you remember what happened in this age with you as well. But when you observe the abdomen and find the scars, my dear, you have some idea what that something from inner organ maybe displaced or taken off, yes, or some perfect disease exists on the inner organ as well. So patient's movement or legs, therefore, so those with peritonitis, appendicitis prefer to lie very still, as any motion causes further peritoneal irritation and pain. Contrary to this, patients with kidney stones will frequently rise on the examination table, unable to find a comfortable position. Understand? Yeah, so it's easy. Let's make it bigger. To more visual effect, I will increase my V as a picture. This is, I think, our patient is given in the first look. So see, staying at the foot of the patient, you look on the abdominal side. What can you see? It's round, bulging, symmetrical both sides, yes, from the midline mainly. Yes, likely something exists on the skin, but not so dramatically interesting to us. So we can think and encode the other parts, hands and cheeks as well, are round. We can say that this abdominal side is only from extra weight, so obese abdominis. This one, my dear. What can you see here? Patient is thin enough, yeah. So when you take these lines, as I taught you, this vertical and transverse, what can you find? Mainly on the right side, yes, slightly to the left. Which organ is in the upper quadrant? Mainly in the right side and slightly going to the left. It's HEPA, my dear. Yes, it's liver. So here you can say that this organ, which is seen here very dramatically bulging out, maybe is HEPA. So hepatomegaly can be discussed here from the first view. As well, you have to check them more dramatically, but why not? What you can find here, as well as in the first hour picture, see, it's big abdomen, but something is very interesting. If in first it's bulging in the middle side, see, going up like mountain, here middle side is not going up, but it's leaked on the side. How do you think why? Because inside the abdomen is liquid, and the liquid always by the gravity power is going to the ground, so it cannot bulge here like mountain. It's leaked down on the one and another side to be closer to the transverse line, to the ground side as well. So it's liquid that makes it, yeah. And as well, the second part which you have to look, it's not seen here, but shoulder and head, you cannot see the cheek as well. You can find out that they are not so fat as in the first picture. Thin hands and big round abdomen which leaked on the side gave you idea that here can be, it's not 100%, it can be ascites. Why we say can be? Because now we have to check more dramatically to avoid any kind of mistake here. Okay, this one. So when you do this transverse line, and because it's covered under the trousers here, so above the transverse line, which now here is given like this line of trousers, above it you can find some bulging on the right upper quadrant near the rib cage. Near the rib cage, perfectly in the middle side of the right quadrant, we have to find gallbladder. So this is given like these two letters given here, gallbladder. So markedly enlarged gallbladder. You can see here, like bulging. If it will be HEPA has structures slightly going on the left side, so you can find all of them. So it's more looks like gallbladder. Once again, I will increase the size, excuse my dear. Oh, here you can find something very interesting. How do you think what it can be? Some round portion is asymmetrical. Yes, here is umbilicus, perfectly in the umbilicus begins, and going on the left side, some bulging exists. What it can be, umbilicus is the most non-protecting part because here is sewing on this line. See this line? It's named white line. Yes, here is dark slightly, but it's named linea alba. When two parts of muscle are sewed to each other, so it is one of the most easy damaged portions. So this is hernia, my dear, umbilical hernia. Hernia when inner organ comes out through the tissues and bulge the skin like this. How to find out? Sometimes you cannot see it so, like in our patient. I take only the most important visual patient, but sometimes you cannot do this diagnosis only by the looking. What you will ask your patient, you will do some Valsalva uh, Valsalva maneuver. Here, look, when you do Valsalva maneuver, it bulged out more dramatically. This is the same patient, as you see. After the maneuver, you see how it increased bulging. Let's see what is our Valsalva maneuver. Okay, my dear, I find it for you. It's only 1 minute, so I think it's good. You have to increase inner pressure. How you will produce it? Let's see. Okay, it rise intratracheal pressure as well. Understand? Yes. So when you stop breathing and try to breathe inner abdominal side, you will increase pressure from inner side and bulging exists, and you can see this kind of herniation, my dear. So, Valsalva maneuver definition here is given for you for sure. The Valsalva maneuver is a breathing technique that can be used to help diagnose problem with autonomic nervous system. It can also be used to help restore a normal heart rate if your heart starts beating too fast. Named after 17th century Italian physician Antonio Maria Valsalva, the technique requires you to try exhaling when your airway are blocked. A version of Valsalva maneuver can also be used to help balance the air pressure in your ears. In addition to closing your mouth and pinching your nose, your bear down as if having a bowel movement. The maneuver causes several rapid changes in your heart rate and blood pressure. You should first try this technique under a doctor's supervision to make sure you are doing it correctly and for a safe but effective amount of time. How to perform the maneuvers? To perform the Valsalva maneuver, follow the steps in order. First, pinch your nose closed. Then, close your mouth. Try to exhale as if inflating a balloon. Bear down as if having a bowel movement. Do this for about 10 to 15 seconds. The Valsalva maneuver can be done sitting or lying down. Ask your doctor which approach is right for you. After inspection, after all this portion, we find out, my dear, the shape of abdomen, color of abdomen as well, tissue color gave you some explanation. If it is white, pale, if it is bluish, if it is yellow color, I think it was discussed with you with Madonna as well when you went through the skin as well. So these colors and some petechias on the skin, some vessels, some stars, some other kind of point must be discussed and signed and noted down by you to make a right decision and the right diagnosis, because all this changing in the skin gave you additional information about what's happened inside and the cause of the changing in the abdomen. After the inspection, you have to auscultate the abdominal part. Why you auscultate first? Because inside our skin and muscle, we have soft tissues like intestine in which the movement exists frequently. So non-stop processes going through the intestine. They are always moving. So what we have to find here? We have to find some sounds. If here is no sound, it's very bad sign. But if I'm in the beginning palpate, so press abdomen with my finger, I will change the liquid which is inside the intestine. So when I auscultate, I can find out some sound, but it will be from my hand movement, not from its own muscles movement of intestine. Let's see. What exactly are you listening for and what is its significance? Three things should be known. Are vowel sounds presenting or not? So it must be sounds inside the vowel. If not, it's bad sign. If present, are they frequent or sparse? For example, quantity. What is the nature of the sound as well? What kind of sound you find here? As food and liquid course through the intestine by means or peristalsis noise, referred to as bowel sound, is generated. The sound occurs quite frequently on the order of every 2 to 5 seconds. Also, there is a lot of variability. Vowel sounds in and of themselves do not carry great significance. That is, in the normal person who has no complaints and an otherwise normal exam, the presence or absence of vowel sounds is essentially irrelevant. For example, whatever pattern they have will be normal for them. In fact, most physicians will omit abdominal auscultation unless there is a symptom or finding suggestive of abdominal pathology. However, you should still practice listening to all the patients that you examine so that you develop a sense of what constitutes the range of normal. Vowel sounds can, however, add important supporting information in the right clinical setting. In general, inflammatory processes of the serosa, for example, any of the surfaces which cover the abdominal organs, as with peritonitis, will cause the abdomen to be quiet. Vowel sounds will be infrequent or altogether absent. Inflammation of the intestinal mucosa, the inside of the intestine, as might occur with infections that cause diarrhea, will cause a hyperactive vowel sounds. Processes which lead to intestinal obstruction initially cause frequent vowel sound referred to as rashes. Understand these differences, my dear? So, think of this as an intestine trying to force their contents through a tight opening. This is followed by decreased sound called tinkles and then silence. Alternatively, the reappearance of vowel sound heralds a return of normal gut function following an injury. After abdominal surgery, for example, there is a period of several days when the intestine lie dormant. The appearance of vowel sound marks the return of intestinal activity, an important phase of the patient recovery. Vowel sounds then must be interpreted within the context of the particular clinical situation. They lend supporting information to other findings but are not in and of themselves pathognomic for any particular processes. When we speak about the auscultation, we have to remember that we auscultate not only bowel or intestinal sound, but as well we have to find abdominal aorta sound as well. So we want to find out, is here any aneurysma or not? Is here obturation of some branches of aorta or not? Is here any problem with distribution of blood to the organs or not? This is very important. So it's not big amount of. So we have abdominal aorta coming through the diaphragm perfectly. Then it has the first branch is going to the kidney or renal arteries, some specific branches to the intestine, and then it's divided on two portions, iliac internal arteries, which then comes out from the leg. So let's see, my dear. This one must be checked. Abdominal side, renal, iliac one, and I will show where and how to take the stethoscope to find this portion. So, where is more? Okay, here. It's only drawn here like this picture, but mainly these branches must be below the umbilicus, okay? So, what we do? Yes, aorta is slightly from xiphoid process on the left. So we take stethoscope not perfectly on the medial and the xiphoid process, but on xiphoid to the left side here, my dear. And we find out some pulse and some sounds coming from aorta. If here exists some murmurs, it means that we have stenosis or aneurysm, and then we will understand which kind of problem exists. We only sign that some extra sounds exist here. Then we take our stethoscope near the umbilicus, take it 2 fingers above, 2 fingers on the side, so these are 2 angles, and we will listen to the renal arteries. It's very important to understand that in the kidney we have some problem as well or not. If here will exist some abnormal sounds, we will understand that we have some renal problem on the sides. Then the same manner umbilicus, 2 finger below, 2 centimeter better to say, and 2 centimeter on the side, you will find this bifurcation and perfect listen the iliac, internal iliac, common iliac arteries sounds. And if here exists some extra sounds, you will find out that problem exists not in the abdominal aorta, but in this bifurcation. So let's see. Okay, let's see small movie. I think I have this one. Auscultation. I think this one is. Let's see, my dear. Why not? It's very interesting for us how they took it. So I gave you more proper sizes, but you can hear by the practice more low portion or more upper. After you have finished noting vowel sounds, use the diaphragm of your stethoscope to check for renal artery grooves. A high-pitched sound, analogous to a murmur, caused by turbulent blood flow through a vessel narrowed by atherosclerosis. The place to listen is a few centimeters above the umbilicus, along the lateral edge of the isa rectus muscle. Most providers will not routinely check for bruits. However, in the right clinical setting, patient with some combination of renal insufficiency, difficult to control hypertension, and no vascular disease. The presence of bruits would lend supporting evidence for the existence of renal artery stenosis. When listening for bruits, you will need to press down quite firmly as the renal arteries are retroperitoneal structures. Atherosclerosis distal to the aorta at the take of the iliac arteries can also generate bruits. Blood flow through the aorta itself does not generate any appreciable sound. Thus, auscultation over this structure is not a good screening test for the presence of aneurysmal dilatation. The technique for percussion is the same as that used for the lung exam. First, remember to rub your hands together and warm them up before placing. So, what is percussion? You remember I say, and we will see it now in the video as well. Place your left hand firmly against the abdominal wall, such that only your middle finger is resting on the skin. Strike the distal interphalangeal joint of your left middle finger second or 2 or 3 times with the tip of your right middle finger using the previously described floppy wrist action. There are two basic sounds which can be elicited. Tympanic drum-like sound produced by the percussing of an air-filled structure, and the dull sound that occurs when a solid structure or a fluid lies beneath the region being examined. Special note should be made if percussion produces pain, which may occur if there is underlying inflammation, as in peritonitis. This would certainly be supported by other historical and exam findings. See on this picture, my dear, what we say? Take one hand over the skin perfectly. The third finger must be firmly taken on the skin, and your another hand will tick by the phalanges on finger on finger to take the sound on. Let's see how it will be. I think I have some. Not, if not, I will find. Let's see. Okay, my dear, I think it's very informative to you. Let's see then what we have to do. What can you really expect to hear when percussing the normal abdomen? The two solid organs which are percussible in the normal patient are the liver and spleen. In most cases, the liver will be entirely covered by the rib. Occasionally, an edge may protrude a centimeter or two below the costal margin. The spleen is smaller and is entirely protected by the rib. To determine the size of the liver, proceed as follows. Start just below the right breast, in a line with the middle of the clavicle. A point that you are reasonably certain is over the lung. Percussion in this area should produce a relatively resonant note. Move your hand down a few centimeters and repeat. After doing this several times, you will be over the liver, which will produce a dull sounding tone. Continue your march downward until the sound changes once again. This may occur while you are still over the ribs, or perhaps just as you pass over the costal margin. At this point, you will have reached the inferior margin of the liver. The total span of the normal liver is quite variable depending on the size of the patient, between 6 and 12 centimeters. Don't get discouraged if you have a hard time picking up the different sound, as the changes can be quite subtle, particularly if there is a lot of subcutaneous fat. Next portion which you have to remember, what we have to check is palpation. Palpation is pressure on the wall to find out inner organ and their distribution, my dear. First, as we say, you have to warm your hand by rubbing them together before placing them on the patient. The pad and tips, the most sensitive areas of the index, middle, and ring finger, are the examining surfaces used to locate the edge of the liver and spleen, as well as the deeper structure. You may use either your right hand alone or both hands, with the left resting on top of the right. Apply slow, steady pressure, avoiding any rapid sharp movements that are likely to startle the patient or cause discomfort. Examine each quadrant separately, imaging what structure lay beneath your hand and what you might expect to. This is the portion where you have to do it once again. How we do it? We begin with the right low quadrant, going up on the left and down, clockwise, as I remember. Yes, it's named. So, 10 centimeters below the rib margin in the mid-clavicle line. This should ensure that you are below the liver edge. In general, it is easier to detect the abdominal if you start in an area that you are sure is normal. Gently push down posterior and towards the patient's head with your hand oriented roughly parallel to the rectus muscle, allowing the greatest number of fingers to be involved in the exam as you try to feel the edge of the liver. Advance your hands a few centimeters cephalic and repeat until ultimately you are at the bottom margin of the rib. Initial palpation is done lightly. Following this, repeat the examination of the same region but push a bit more firmly so that you are interrogating the deeper aspects of the right upper quadrant, particularly in the patient has a lot of subcutaneous fat. Pushing up and in while the patient takes a deeper breath may make it easier to feel the leverage as the downward movement of the diaphragm will bring the liver toward your hand. The tip of the xiphoid processes, the bony structure at the bottom and of the sternum may be directed outward or inward and can be mistaken for an abdominal mass. You should be able to distinguish it by noting its location related to the rib cage. You can also try to hook the edge of the liver. See how it will be? Stay slightly on the right side better and slightly near more head portion, cranial sides and to the foot. Take your forefingers and make hook below the rib cage, below the rib cage. Try to press firmly 5-6 centimeter depth and then take it up below the rib cage. So in this kind of hooking, you will touch the edge of the liver perfectly. And it will help you to understand the position of the liver and gallbladder as well, because gallbladder by this touching can be painful and it will give you understanding about the inflammation inside the abdominal side, perfectly in the gallbladder. Let's see how it is given this examination for you. And I think for today examination of abdomen is fully done. We will only recheck what we have discussed today. Let's see. Come on. Okay, my dear, I think it was informative to you. For sure, all these parts. Please follow our presentation and videos as well. Once again, what about we spoke today? Let's repeat slightly. That we divide our abdomen or on a 9 or 4 quadrats. The main point where which must be discussed. Then to know the main organs inside our abdomen, where which one is, beginning from which part, that observation or inspection is the first part always. What you have to find out through the observation. Different kind of problem which can exist, my dear, in the patient. Then Valsalva manner for sure. Then auscultation, why we need auscultation, what is normal sounds, what is abnormal sounds in the abdomen, why it is important to do auscultation before other kind of examination. This question will be in your exam, my dear. Now, from which quadrant you begin? Okay, the main idea is it's that from right side to the left side. On the ring side, on the clockwise kind of. So then, what you have to find and how, in which period, 2 to 5 seconds frequently, yes, the sounds occurs, but you have to wait 5 minutes if it is dullness. Then what kind of problem can exist for sure, rashes and so on. Then we have to think about the arteries here, the main arteries in abdominal side, like aorta with its branches. Then come percussion and percussion technique. You have to remember technique of percussion. This will be in the exam questions, where you begin, how you follow, and why percussion is not the first one. After the observation as well. So what kind of sound are normal for which kind of organ? I do not want perfectly the hepa or spleen. I want filled with liquid or filled with air and so on. So tympanic, drum-like sound produced by percussion over the air-filled structures. Dull sounds that occurs when the solid structures, yes, liver fluid and so on, exist. Then special note should be made if percussion produces pain. This must be remembered. Then what we have to speak about. So what we can percuss, what not. Then palpation. So what is palpation? Why we use palpation? How we use palpation? From which angle you begin, how you follow. So here it's a right upper quadrant. Okay, it doesn't matter right or low right quadrant, but I like to begin with right low quadrant and up, then on the left, and then down on the left. It is the most useful and normal distribution, but okay. So what is two kinds of palpation, light and deep palpation, which organ can be palpated, or what is the landmarks via and which organs exist, what is hook method. This all the question will be in your exam question for sure. As in midterm, so in the final as well. Okay, so prepare, read. I gave you a lot of pictures here. This presentation will be uploaded as well on the portal as well. You can follow the videos because here is involved some YouTube movie as well, which I perfectly find for you. Not every is useful. This one is good as well. So I think, my dear, that's all what we have to do. If you have any kind of question, you can write me. You can write me, my dear. and it will be good for us. Okay.